Good afternoon and welcome to the special Superintendent's Webcast on June 30th, 2020. Just when you think we should probably have a light agenda, we have another heavy agenda today. I also know it's a holiday week, but we want to thank you all for joining us. And if you're also watching it at a later date, thank you for tuning in as well. Several days and weeks ago, we thought about canceling today's webcast as well as yesterday's task force. And we also thought about canceling next week's superintendent advisory and superintendent webcast just because we know this is a holiday week. This may be the first time that you and your family have had a chance to even maybe even take a short day trip. But we're going to continue on because we know it's important, particularly with the release of the Healthy at School guidance last week. We know there continues to be questions. And then also, as you'll hear in today's webcast, we've had 2 guidance documents released this week. And that was waiting on the public health guidance. And as you know, we layer in some of the public health expectations into our guidance documents. So in short, we're just going to go on and get you the information you need, and knowing that some of you may need to watch this later on if you're traveling, and if you are, safe travels to you. We're going to start out with a communication update with Jennifer Ginn with KDE's Office of Communications.
Okay, can you all see the PowerPoint?
Yes.
Excellent.
Jennifer, I think, you got it full screen. Thanks.
Okay. Just a little bit this is a repeat of some information we've shared before. We are still issuing new guidance. As the commissioner said, we had 2 pieces come out this week, facilities and logistics, and CTE, some information about CTE as well. You can find all that information on our KDE reopening page, so check that out frequently. To date, we have issued 10 guidance pieces, which you'll see here, for the reopening of schools. Included in this is the one with DPH. On the 24th. We do still have a few pieces of guidance that are set to be released. The majority of our guidance, however, is already out there. But don't worry, we are listening to your comments, and as we hear that you all, your needs change, we will produce more to suit your needs. Our needs sensing surveys are mostly done. As you can see, we have had some fantastic response on these. Nearly 60,000 family caregivers, including more than 200 in Spanish. We do have one that is still open, classified staff. It will go through July 5th. It will close on July 6th. We've already had almost 8,000 people respond to that one. Thank you for sharing those with your teachers, with your families. And if you can please help us get this survey into the hands of your classified staff, that would be fabulous too. The more information we can get, the more we can make sure that we are meeting your needs. Okay, hold on. My PowerPoint seems to have frozen. Sorry about that. Okay, the Kelly Award. We are still accepting nominations. We have 9 nominations so far. This is for business and education partnerships. You can see the criteria for the award on your screen. We know there are a lot of good programs out there. We would really like to consider them for this award and to recognize them. So if you have programs, if you know partnerships that you think fit, please make sure you go ahead and fill out the nomination form. We're taking those through July 15th. And the commissioner search, last Thursday, KBE narrowed the field to 4 candidates. We're planning on announcing those 4 finalists sometime this week. They will have interviews. They will meet with the state board next Monday and Tuesday. We could possibly have an announcement on who the next Commissioner of Education will be as early as next Tuesday, but they may need some more time. So Tuesday at the earliest, but possibly it may take just a little bit longer than that. All right, and now we're on to Jim Flynn.
Jim needs no introduction. We are happy to have Jim with us today. And as you've heard us talk about early on, we talked about a need for a repository for the plans that you're creating, the reopening plans. And Jim stepped up to the plate through KASS and to create that repository. And we really appreciate him and the organization for doing so. So Jim, I'll turn it over to you.
Okay, thank you. Can you hear me okay?
Yes.
All right. Well, good afternoon, everyone. As the commissioner said, we had some superintendents ask for a place to deposit their plans for the reopening so that folks could share and collaborate. So KASS has provided that. Some of you all have already submitted your plans, but now that the Safe at School guidance is out, we're anticipating more folks will begin depositing their plans at this site, and that way we can share and gain confidence as we navigate these incredible, challenging circumstances that we're in. Just make sure you start by labeling your plan with your district name first so that folks know who it's from. And you've got a link to that, and I'll be sending periodic updates out with that link so that you can access it easily. Within the site, there's a reopening resource folder full of information from other states and agencies, including a link to all the KDE resources. But feel free to add to this section or send me something that you think needs to be shared. And again, collaboration during this unprecedented time is key to navigating these complex decisions for reopening school. So I encourage you to share your reopening plan and to utilize this resource with your district teams, because multiple heads are better than one. So let's just put our heads together and we'll find the best way forward possible. And that's it. So thank you all. And if you have any questions, just reach out to me.
Thank you, Jim. We're having a little bit of some technical difficulties with the advancing of the slides, and we're working on that. Those of you watching and listening, just know that the link that there are two slides related to the Jim's presentation, and one of the slides, the second slide, has the link he's talking about. I think he's going to also, of course, email that to you. But if you go into your PowerPoint in your email or on your calendar, you can find that slide as well. And I apologize. We've been having an increase in screen share issues. And so we apologize for that. Hold it. Just give us a few seconds, Jennifer, until we get to the next.
Are you seeing the new guidance up?
No, we're still on the need sensing survey. I think it left you there. You may have to go out and come back in.
All right, let's try that. All right, let's try it again.
There you go.
Okay, excellent.
And go back up if you can to the Jim slide.
Nope, whoops. There we go.
And if you can see Jim's slide there about sharing your reopening plans, he will also send that to you, superintendents, but then the link is also included in this slide. Thanks again, Jim and KASS, for that service. I also just want to let everyone know we have just due to some logistical issues today and some staffing issues, we're going to defer the questions to the very end of the webcast instead of taking questions after each segment. So we will do question and answers as we normally do, but we're going to do all of those at the very end. We have Lisa Hanley and Kay Kennedy to go over the new guidance regarding considerations for reopening schools related to pupil transportation.
Thank you, Kevin. This is Kay Kennedy, and along with Elisa Hanley, we'll be talking to you this afternoon about pupil transportation. If you could advance the slide, please. The pupil transportation guidance really talks about several things, and I'll walk through what the guidance covers and then turn it over to Elisa Hanley, who will actually show you the document and the various components that we would like for you to use. So we'll first discuss the transportation options and the fact that this year parents may choose a different option for their student for their transportation to and from school. So again, we're going to encourage you to survey your families, and there may be a need to adjust your traffic patterns and various entrances, not only into the campus itself, but also into the school building to avoid any unnecessary bottlenecks. Advance, please. We'll be discussing the mitigation strategies that will be necessary to ride the bus. As you know from our conversation with the Department for Public Health, we may use an increased capacity on the bus, but that adds a mitigation strategy of wearing the mask that we need to implement. We will also talk about assigned seating, temperature screening, and the use of hand sanitizer that will be important to keeping those riders and the staff safe. Next slide, please. Okay. So included in the documentation, you may have noticed some charts that will describe various capacities that you may utilize on the bus depending upon the capacity that you wish to achieve. And so hopefully those will be helpful to you as you can think through the various options that you have. So Elisa will be discussing those. Next slide. And then we wrap up the guidance with a discussion of employee health and safety. That is those folks who keep your buses running, as well as the drivers and monitors and other folks that are involved in the pupil transportation function. So we'll talk about self-assessment for health screening for your employees, the use of PPE, personal protective equipment, and then how do you go about making sure that the bus is cleaned, sanitized, and disinfected according to the CDC guidelines. So knowing what the document covers, I'll turn the program over to Elisa now, who I think will want to share her screen so that she can talk about the guidance document itself. Elisa?
Thank you. And I believe that you had the guidance document you were going to bring up. Karen. Or Jennifer, excuse me.
Okay. Okay. Can you see it?
No, I cannot.
Right.
I can bring it up though. I can share my screen.
I'm just going to have to back out and then go back into it.
Okay.
Every time I switch, it looks like that's going to be the case. All right. Can you see it now?
I can.
Okay.
And then we'll just scroll through it. If you can go down to the next page. Okay, right there is fine. Okay, so there's several things that we're asking districts to look at when trying to optimize the number of students on the bus. And the first thing that we're going to ask parents to districts to do is to poll the parents to see if they're going to send their students on the bus, drive them, or have them walk to school. If more parents are going to drive students, then the districts will need to look at the staffing that they have and ensure that they have a way to control the traffic flow. Districts also need to be prepared for the increase of riders after the first couple of weeks, just in case parents are becoming more comfortable with the busing system. So you need to have several different plans in place, one for the beginning of school and then one for several weeks after school starts, just in case this changes. If you can scroll down a little bit more. Another option for districts is to look at their bell times, to not have mixed loads of elementary, middle, and high school students on the same bus. This will help with loading from back to front and worries of where students will be sitting and with whom. Kindergartners may need to sit closer to the front to better see them if you have mixed loads. And keep in mind that they will not have masks. The kindergartners are not required to wear masks. And then walking distances for older students can be increased. Right now, most districts have it at probably a mile or so. So this can be increased. And for districts that pick up within a mile of the school, there's programs available through Safe Routes to School, which provide guidance on maintaining safe walking programs, which will allow younger students to walk versus being picked up. And students can set up walking school buses where students are picked up along the mile route and walk to school. And they have a vetted adult that will pick up students along the way. Okay. Now, what we don't want are students being crowded around waiting to get into school, whether from cars, walking, or from buses. Now, districts will need to think about the processes and implement procedures that will help them facilitate social distancing. This may mean having only 3 buses at a time unloading and taking temperatures of those students while they get off the bus and enter through one door as car riders are getting temperatures taken at another door. Or buses are offloaded first, then car riders can enter, and while walkers are taken to another door. There may be several doors where staff is needed to take temperatures. So using the different strategies available in this document may also limit the number of students in one area that need to be checked before going to school. So once these things are considered, there are required mitigation strategies that will need to be implemented. So if you go back up to where it says mask wearing, all students in first grade and above will need to wear a mask unless there's a medical waiver for those for those students. Students will become used to wearing masks as time goes on. We have asked districts we're asking you to work with parents and students through the summer to acclimate them to wearing the mask for the time that they're expected to be at the bus stop and on the bus. For some students, this may be an hour, and for other students, it may be 20 minutes or less. If you can move down to seating. So districts need to load from back to front. This is why looking at bell times is important. Younger students may end up sitting with older students with the back to front loading sequences. So students will need to have assigned seats, and attendance will need to be taken before everyone leaves the bus. And that's very important for contact tracing. Temperatures will also need to be taken before students go into the school. And there's several choices that districts have to include taking the temperature as they enter the bus. And if this is done, a monitor will be required so the driver can continue to watch the road and other students. Another option would be taking the temperature as students leave the bus. So each student is their temperature is taken and then they go on to the school. Or you may have those students' temperatures taken at the door before they enter the school. If you can move down to hand sanitizer, please. Thank you. Now, hand sanitizer will need to be given to all students as they enter the bus, and this can also be done by a monitor. The hand sanitizer station may be mounted, but there is not one good place to mount it. There's different size pumps that are available, and we're continuing to work with the manufacturers and dealers regarding locations. However, during the summer and the fall, when it's hot, it's not recommended to leave the hand sanitizer on the bus due to the flammability of it. We are also working with a dealer regarding different possibilities of types of hand sanitizer stations. So I will be working with them as well as with the directors regarding this. Okay, and if you can scroll down to the number of students on the bus. Thank you. The number of students on the bus is going to depend on the prevalence of COVID-19 in the community. It will be important for districts to discuss with their health departments to determine if full loads are acceptable. And we have charts, as you scroll down through this document, there's charts available for 2/3 capacity down to 10% capacity. Now, a district may determine that it's safer to load a 66 passenger bus at 2/3 capacity versus doing 100%, which is 44 passengers. However, if you leave the front 2 seats open for potentially 6 students, that would mean that there's 40 passengers on that bus. With any of these scenarios, we do not recommend leaving students at the bus stop if they have a temperature, unless the parent has been contacted and doing so has been approved. It's much safer to take the students to school versus leaving them alone at the bus stop. Each district will need to create a contact plan and procedures to address these issues. Okay, if you can scroll down to employee considerations. Oh, excuse me, stop. Ventilation. You're also going to want to make sure ventilation is done on the bus, meaning opening up the roof hatches and the windows. However, if you have students that have asthma and that are exacerbated by possibly pollens or other environmental items, then you will want to sit them closer to the front with the windows up. Okay. Now, employee considerations. Temperature checks for all employees should be done daily. Even if the driver starts from home, they should take their temperature and inform their leadership if they have a temperature above 100.4. They must wear a mask or a face shield when on the bus. For those who are unable to do so, it will be up to the district to determine if the route they're on is acceptable without a mask. The leadership may be aware of a bus on their bus if there's immune deficient students or other students that may be potentially
Did we lose Elisa?
Yes, you lost me and I just came back. Sorry, we've been having internet issues and connection issues lately. I apologize. Can you hear me?
Yep, we can hear you.
Okay, great. I still have a red triangle. So, okay. So, districts are just going to have to determine that if the drivers that don't have masks, if they are fit for the bus that they are currently assigned to. We want to keep the drivers and the students safe.
I think we lost her again.
Yes, I'm sorry. Can you hear me?
Yes.
Okay. In between the routes and at the end of the day, the buses need to be cleaned. Each manufacturer has provided cleaning guidelines for buses, and those links are here as well in this document towards the bottom. The high touch areas and any used seats should be cleaned, and this may require additional staffing between routes. So each school may have someone that goes through and cleanses the bus with the driver. They could start at opposite ends of the bus and work their way to the middle. And this may be maybe your custodial person that you have jump on in the mornings to help get them cleaned as quickly as possible. This will increase the time needed if buses are doing double runs. In the garage, and this is if you scroll up, in the garage, employees will need to enter through. Right here is fine. In the garage, they'll need to enter through one door and exit through another where possible. Social distancing should be adhered to and shared tools need to be cleaned between use. At the end of the day, surfaces should be cleaned as well. Anytime a technician goes into a bus, they should be wearing a mask and cleaning the area that they're in when they enter and when they leave. Face masks should be worn in the garage anytime social distancing is not adhered to. Now, driver barriers are not approved for school buses at this time. There is a task force by several pupil transportation organizations that have been in contact with the National Highway Traffic Safety Administration, and manufacturers are working on possible solutions for the future, but right now we don't have a solution for this. If you can scroll down, we'll go through the appendix items. We have a sample survey here. If you haven't already started to survey your parents, these are some possible questions that you may want to ask. Now, each district may have additional questions, or some of these questions may not apply to you, depending on the size of your district and what your plans are for reopening. And if you continue to scroll down, we also have a sample for temperature checks. Now, this is what we use on the state level. Anytime we go into our building, we have to have our temperature checked. So for those employees who are starting from home, you may want to create something like this to where they're checking their temperature and answering these questions before they get on their route. And you can have those turned in weekly or every pay period, whatever your district chooses. But anytime these items are, anytime these symptoms are had by any of the drivers or monitors, they'll want to contact their leadership so that you can make a decision at that point. And then if you scroll down, we have one more item. We have the bus manifest. Now, most of your districts should already have some type of bus manifest. But for contact tracing, this is going to be extremely important. So it's going to be important to know what bus and what students were on those buses. And you'll want to do these daily. So you can mark off anytime a student is not on the bus, or you can do it where you mark off every student that is on the bus. But this is going to need to be done daily for contact tracing, because you may not find out that a student or a family member of a student had COVID for 3 or 4 days. So you'll need to go back to those 3 and 4 days worth of manifests. So these again can be kept by the driver and turned in weekly, or however often your district determines that it's needed. And as they stated, we'll have the Q&A after all the presentations, but I'm also going to have a Q&A with directors tomorrow at 1 p.m. Eastern, and they have all been sent their link to be able to access that. I ask that if there are any questions that they have, that they please email me or enter them at that time as well, and I will do my best to answer those questions. And that's all we have for today for transportation.
Thank you, Lisa. I know we're going to have several questions. As we said today, we are going to wait to do all questions at the very end. Next up, we have Kay Kennedy, another new guidance document, considerations for reopening schools, facilities, and logistics. While Kay's getting set up, I do want to point out you've heard me refer to the Team Kentucky, the reopening guidance that we released yesterday or last week at the governor's press conference. I call this the flagship document because it contains the public health expectations and the best practices. And so, because this is a public health crisis, these expectations guide us. And so, for example, you may see some bullet points in here about school bus sanitation or what Elisa just went over. However, they are just high-level expectations from our public health partners and KDE. And then you get into the document that we just now discussed on pupil transportation, and you get into the specifics. So that's why we have right now around 11 guidance documents, and we'll have, I guess, around 12 or 13 in all when we before we get to the beginning of the school year. I know just because we have a guidance document doesn't mean it's easy. We're going this route of having the flagship document and then all the other documents going into details as opposed to just one big, huge document. Some other states are doing that, but we wanted to do that because if you recall, we issued our first guidance document back in May, and that was before we knew what the summer would hold and what the overall public health expectations would be, but we wanted to go ahead and get you that guidance out early so you could start making plans. I just want to give you some background as to how the guidance documents were developed, why they've been developed in this fashion, and the fact that the flagship document, the document where all others come from, is this document that we released in conjunction with public health last week. Kay, I'll turn it over to you.
Thank you, Kevin. So the next guidance document that we are presenting today is for facilities and logistics, and there's no doubt about that making maximum use of your facility and being able to keep a healthy and safe environment for your staff and students will be a huge lift for school districts, but we'll talk a little bit about that today. So next slide, please. So the document covers these areas of cleaning and sanitization, faculty utilization, building systems, emergency drills, and operations. Jennifer, if it's okay with you, may I share my screen and actually go through the document from my screen? Okay.
Fine. Yes, it's fine by me. I've returned control, I believe.
Okay. Can you see my screen now?
Yes.
Great. So somehow or another, I need to get back to the top of the document. Oh, here we go. So in our guidance documents, we do have a number of embedded links that will direct you to additional information that could be changing as the pandemic evolves. So when we have those, you'll see those highlighted links. And when you click on those, you go directly to, as in this case, the CDC guidance on cleaning and disinfecting. So their guidance involves products that are acceptable from an environmental standard, as well as those solutions that you can make yourself that will allow you to properly sanitize areas in the building. So general guidance for cleaning and sanitizing a facility may be found on the CDC website, and what applies to school districts applies to a lot of businesses in general. But you should really plan for making sure that you have enough cleaning supplies on hand, and that you pay attention to any special PPE needs for custodial staff that may be required because you're using different products that you may have used in the past to do a deeper level of cleaning. Now, I know many of you have already been involved in that and are familiar with the requirements of those products. So please read the labels carefully so that you are protecting your staff as they do this important work. We also recommend that you create an inventory of the spaces within your facility so that you can determine the custodial guidelines for staff to follow. This will be useful on a day-to-day basis, even if you have substitute custodial staff who have to come to your building, so that they will know what the expectations are in each individual area. So a little bit further down in the presentation, I'll give you an example of what that inventory might look like so that you can classify the type of service that's needed, the frequency of the service, what products are expected to be used in that particular area, and if there are any particular instructions for that area that your staff needs to follow. And this just gives you a good, consistent way to make sure that that particular area of the building is being treated in a safe and consistent manner. So we'll talk about that a little bit later on. There is in OSHA guidelines, and you see the highlight here, guidance for PPE for your workers. So again, refer you to that. As the situation may change in your district, you may want to change the type of PPE that's needed by staff. So this is a good way to stay up to date through the OSHA guidance that they provide. Another area that will be of concentration for your planning team is the facility utilization. If we are going to try to maintain social distancing, how can we best configure the classrooms and other spaces in the building for the best usage? So what we've included here is two things. One, we have a room capacity calculator, which is a separate tool, and you'll see it on the website as well as I will show it to you today. That will allow you to calculate the capacity of any space in your building. But we've also got a few of those spaces, common dimensions actually listed here, and a capacity chart showing that if you could utilize, in this particular case, 75% of that space, how many students could you have in that space based on a 6x6 block, or if you want to use sort of a circle radius, like a little bubble around each student, or if you have older students who typically take up more space and you want to put consider a larger block that does impact your capacity. We also include that for an 8-foot block or an 8-foot circle. So you see different sizes, and then based on 75% utilization of the space, then you have a certain number of students that you can accommodate. So I'll show you the calculator in just a minute, but it will be important for your planning so that you know how many kids you can handle in a given room at a given time. In addition to capacity in the facility, you have to think about how students can move safely from one place to another. And we recommend that you mark hallways with social distancing reminders. You might put tape on the floor or markings on the wall to help remind students what 6 feet actually looks like. It will be a challenge to keep the little social beings separated, but we have to work on that to the best of our ability. Also in your facility, there are other enhancements that you might want to consider as you plan for the upcoming school year. Can you incorporate multiple hand sanitizer situations? Along with masks, keeping your hands clean is just one of the key factors to combating this illness. Evaluate how you can replenish your hygiene products during the day to make sure you have plenty of soap, paper towels, tissues, toilet tissue, etc. Consider plexiglass shields in public-facing areas such as the reception area or maybe even at your cafeteria cashier station so that you can protect employees who have to interact with students and maybe even folks from the outside. Consider the use of no-touch trash cans. I've also included here a link to the CDC communications site that provides signage that you might want to put up in your buildings to remind faculty, staff, and students of the important mitigation strategies. So being able to print off that signage, you might want to laminate it, mount it in strategic places to keep reminding people that these are the things that we need to do. Next, we'll talk about building systems. One of the ones that people have referred to most often is the ventilation within the building. So we've included a couple of papers here from the American Society of Heating, Refrigeration, and Air Conditioning Engineers, commonly referred to as ASHRAE. And their guidance is consistent with not only the World Health Organization, but CDC as well. So links to that for your plant operating people. We'll give them some considerations about basically 3 topics in the area of ventilation, and that is dilution, how you can best reduce the concentration if there are infectious agents present, filtration, that is trapping bacteria and viruses in a filter, and then purification, destroying the infectious agents that may be present. So those are 3 topics you might want to familiarize yourself with and how you can best accomplish those in your particular facility. And if you have any question on those, you might need to have a conversation with your manufacturing representative for your particular system if you want to make any changes or contemplating any upgrades. At a minimum, you might want to think about changing your filters maybe a little bit more frequently than your current maintenance schedule. And that's a pretty easy thing to do. Anything else might involve the expenditure funds that you've not really prepared for. So try to do it the best you can. And the important thing is ventilation. I know we have rules around locking the doors and windows during the instructional day, but to the extent that you have the ability to improve circulation, please consider that. And yesterday we were fortunate to have the state school security marshal, Mr. Wilcox, on the phone, and their group is ready to help districts consider if there need to be considerations for locked doors or windows that would improve ventilation, yet maintain the safety of the children in the school. The next topic that we cover is the need to continue your emergency building procedures, fire drills, lockdown, severe weather drills, earthquake drills. Those still need to happen. Just because we're having a global pandemic doesn't mean that Mother Nature may not take her wrath out on us in a different way. So you're encouraged to have those drills. but you can do them in a safe manner. John Akers from the Kentucky Center for School Safety has provided us with the guidance below that he suggests may allow you to put your students through those drills in a safe manner, give them an idea about what needs to happen in those drills, but do it safely, maintaining social distance, so at least they know how the drill is supposed to work in the event that an emergency actually does happen. Next on your campus, you may need to consider vehicular traffic control. You know, if you're doing new construction or you're preparing a site, one of the first steps is to involve the highway folks and local law enforcement folks who can help you best plan entrance and egress from your property. You may need to reconsider that if you have more car riders than you're used to handling, or you want to direct people toward a different entrance than you've been used to doing. So have that conversation and give consideration to vehicular traffic control, and then communicate that to your families just as soon as you know there will be a change. Okay. Drop off and dismissal will likely look different with the need to take the temperatures of students entering the building. So plan carefully for that. You set up perhaps multiple stations to alleviate any potential bottlenecks. And you may want to stagger arrival of students best you can. I know that's a challenge on a good day, is to get students headed in the right direction. And your ability to stagger that is probably limited, but maybe from the bus perspective, you could make disembarkation plans similar to how they unload airplanes. You might get to the gate, but it might not be your turn to actually pull up to the gate and unload just yet. So work through that plan with your team. Student dismissals should be fairly straightforward. No need to take temperatures on the way home. Hopefully, all of your students have made it through the day well and safe. If a student does present ill during the day, get them home some other way besides the bus, if at all possible. If you have a child who is sick, do your best to not send them home on the bus in an effort to eliminate that as a possible point of contaminating other students. Okay, so there are a couple of appendices in this document. Here is a sample site inventory worksheet where you may list all of the particular building areas that you want staff person A to cover. What type of service does the area need? Cleaning, sanitation, or disinfection? Those are three different types of cleaning. How often does it need to happen, and what products do you want to use? So you may do a general cleaning Monday through Thursday, and on Friday for the particular area you may want to do a more thorough disinfection. So you can make note of all of those plans so that whoever happens to be working that particular duty roster can follow the instructions from the site inventory worksheet. Many of you already used a checklist for your custodial staff to ensure consistency in the services that they provide. It might be more important now that we make sure that all of the areas are covered. So here's an example of a custodial checklist if you need that. There is one other thing I'd like to show you, and that is the room capacity calculator. So I think I need to maybe unshare, maybe stop sharing this screen, and now go back to share this screen. Nope, it appears to be the same screen. So let me try that again. Okay. Now I want to share. So on the website, there is a separate room capacity calculator, which is a spreadsheet that has been adapted for your consideration. So in this spreadsheet, you can take any space in your building, put in the square footage, put in the percent of usable space, and it will give you an occupancy, a capacity for occupancy in that particular area. So let's say, for example, you might have a, let's say you might have a 3,000 square foot cafeteria that you can use 80% of the space. So if you want to use a 6-foot block consideration for social distancing, you can get 67 students in that space. If you want to go a little bit bigger with your social distancing, then you, of course, have fewer number of students that you can accommodate. So again, if you're able to use more of that space, say you could use 90% of the space, it does change the number of students that you could put in that particular space. So again, this is a very simple little calculator that would help you if you're trying to determine where you can make best utilization of the various spaces in your facility. All right, again, that's the end of the presentation about the guidance document, and we'll be around to address any questions that you may have at the end of the program today. Thank you.
Thank you, Kay. I want to correct something I said earlier. I think I misspoke. We will have a total of 16 guidance documents by school within the next few weeks, certainly before school starts, just to show where we are. The Healthy at School document that we're referring to as the flagship document released last week from Public Health of the department, that's number 8. The transportation document that we reviewed today is number 9. Facilities and logistics that Kay just went over is number 10. Career and technical education that we're getting ready to hear about is number 11. And then over the next few weeks, you will have 4 more. Number 12 will be workplace health and safety. Number 13 will be teaching and learning stage 2. There was already a teaching and learning stage 1. Number 14 will be exceptional learners in preschool. Number 15, compensatory education and extended year services. And then we anticipate the last document, or at least the document to get us to the school year, will be performance-based instruction. And then just like you're hearing the governor talk about the Healthy at Work document, there may be times where we need to change some things in these documents depending on what the virus does and how things are going. We will certainly let you know when any of those changes, and then we'll put version numbers on there to make sure that when that happens, you know which document to reference. So up next, we have Tom Thompson with KDE's Office of Career and Technical Education. He's going to go over the reopening guidance for secondary career CTE facilities and completion of industry certs and lab-based dual credit. Tom?
Thank you, Commissioner Brown. Could we advance the slide, please? So I want to point out in this document, as well as what Kay had mentioned earlier, that there's links to the Healthy at Work, and we tried to stick with all the Kentucky documentation. And there's also a link whenever you get in there to sanitizing. When it talks about sanitizing the classrooms or the materials, then there's a link to that as well. Could you change the slide, please? So a little bit about the background. The Special Superintendent's Webcast on May 19th outlined the governor-approved plan for secondary students to return to KCTCS campuses for completion of dual credit lab coursework. So this document goes a little bit a step further. That one was to get us up to that June 30th. This new guidance outlines the governor-approved plan for students to return to secondary CTE labs and classroom beginning July 1st. Through the remainder of the summer weeks to complete dual credit lab courses and industry certification exams from the 1920, the 2019-20 academic school year. And previous guidance that we had given, we wanted to focus on those graduating seniors from the class of 2020 to give them priority for this opportunity to return. And when we're thinking about industry certifications, you know, with accountability not being part of it, we're really looking at those students where this will benefit them in their career moving forward. Next slide, please. So the whole document looks similar to the rest of the documents that are online currently, and it's broken down into 4 general areas. So general requirements, which is the bulk of the guidance, arrival and dismissal, transition between classrooms and labs, and then we've got some area-specific guidance that's broken down into classrooms, computer labs, and the CTE area labs, or the shop areas of those programs. Next slide, please. Thank you. So we're going to be asking these facilities to seek guidance from their local health department anytime they're working on and creating this plan. So if at some point, whether it's in the beginning and helping create the plan, or if they're reviewing the plan before the students begin work there, we really want them to be involved in it. We're going to ask you to work closely with your designated Healthy at Work officer and ensure the development of the plan for addressing students who test positive for COVID-19. So the contract tracing, keeping track of who was in the building and all that sort of thing. This plan should be established prior to reopening with the input from the local health department. Next slide, please. So we want you to prepare the plan to determine which students will have opportunity to test or complete dual credit. And like I said earlier, we want to prioritize those graduating seniors first. As far as local districts are concerned with CTE programs, you're probably going to have a good handle on who's going to be testing, and the communication will go out. We'll all be on the same page. But when we're dealing with area technology centers in multiple sending districts, we want to make sure that those area technology center administrators are communicating with their high schools or their sending schools to make sure that we all know what students are going to be participating and who has the permission to do so and what times they're coming, so that we know who's in and out of that building. So we want you to prepare a communication plan to reach those students who will have the opportunity to test or complete dual credit, those lab opportunities. And then we want you to include the parents or guardians on those communications. In some form or fashion, permission slip, possibly, we want you to confirm the student's willingness and parent and guardian approval to participate in in-person completion of those industry certifications, assessments, lab-based dual credit. And if the student is over 18, we would request that student give the parent or guardian notice of that. Next slide, please. So further general requirements will require that the scheduling of students and conduct with compliance with the Healthy at Work minimum requirements. Anyone entering the school must complete daily temperature checks and health checks. And I believe the same document that was shared earlier that KDE is using for their employees is a good example of the document to use for those daily health checks. We want you to maintain records of all the students and staff in the building, back to that tracing aspect if we need to get to that point. And then prohibit access to water fountains, bathrooms, must be used in a limited number of people that would allow proper social distancing. Next slide, please. We want you to require proper hand washing and hygiene. I know a lot of this is repetitive, but it was a standalone document that I think it really needed to have some of this repeated. So hand sanitizing must be required before students start any of the work in the facility. High-touch surfaces must be cleaned on a recurring basis. Any of the tools the students use, hand tools or equipment that they use, the classroom surfaces need to be taken care of. All staff and students must wear cloth face mask or face covering according to the CTE program safety guidelines. unless total isolation can be maintained. And when I say total isolation maintained, there's a possibility the student may be in an isolated welding booth by themselves where no one else is in there. That may have, and they're also going to have their welding helmet on at that point. So we felt like that was an option there. We want to keep in mind that when you move, you mask. So anytime they're moving from those different parts of the lab or from the lab to the classroom, or if they go to the restroom, anytime they move, we want them to wear a mask. Next slide, please. So adherence to the additional requirements by the assessment vendor. So any of these tests that we have, there may be other requirements that go along with it for whoever supplies the industry certification test. To the greatest extent possible, we want to keep the same groups of students together as much as we can in order to minimize contacts and support contact tracing efforts should a positive case happen. Next slide, please. Thank you. So the next piece of guidance goes along with arrival and dismissal, and there's two bullets for that. Basically, we just want to make sure that staff and students remain in their vehicles and away from the entrance to the school until their designated arrival time. Queuing, waiting areas, and waiting lines should be avoided unless proper separation can be maintained. Arrangements should be made to allow students time to check in and enter class in the lab in appropriate time. So when you're scheduling these, please schedule them in plenty of time that they can get there, and you can call them in and go through the screening process and get them to the appropriate area without that bottleneck, if you can do that. No more than the maximum number of people per the Healthy at Work guidelines. Requirements should be allowed in each area at any given time. If the area is to be accessed will not allow 6 feet of separation, the area should be avoided or used in rotation only. And I'm talking about like tool rooms, storage areas, or welding booths that are just these small compact areas where really only one person needs to be in there at a time, especially when we have a limited number of folks in the building completing industry certifications or lab work. Next slide, please. Thank you. So the next section of the guidance document is a transition between classroom and lab. So students will be released in small groups with instructions to maintain social distancing. Preparations will be required to ensure orderly transition. Teachers will set out materials, tools, prints prior to the work. Any of that stuff, if it was used in other days and students cannot supply it on their own, there should be proper sanitization of those materials or the equipment. Students moving between labs will make every effort to maintain reasonable distances from one another and the instructor, and students will be asked to inform teacher assistants should they need to move between labs or be excused from the lab. Next slide, please. So then we have the area specific, and I won't go through each area, but this is kind of the general guidelines for the classrooms, computer labs, and CT area labs again. And when you read the document, you'll have a little bit more specific detail for each individual piece. So, but generally, seating should be separated at least 6 feet with designated seating labeled. For sanitation purposes, students may be asked to provide their own materials needed for industry certification to lab-based dual credit coursework, if possible. We're talking about pencils, calculators, notebooks. Schools should be prepared to provide such sanitized materials if the student is not able to provide it on their own. Computer workstations, desks, materials, equipment, tools, seating should be disinfected after each use. And instructions should be given regarding the use of healthcare personal protective equipment when used in conjunction with program-specific PPE. And when I'm talking about that, for example, face shields when you're grinding on something, and welding helmets. So there's going to be other times when the PPE that you have may interfere with the other PPE that students are typically used to wearing when in these types of environments. And I know the students, they're already used to wearing that type of stuff. So I think if we just sell the reason and the need for this additional PPE, I think it'll go along with the coursework that we're already doing. Next slide, please. So any follow-up questions, you can get a hold of Leslie Slaughter. She's our executive advisor. She has helped proof this document and go through it and put it all together. If you've got any questions about it, you can reach her or myself. Our contact information is there. And I appreciate you guys, everything that you're doing out there. So hang in there.
Thank you, Tom. All right, we're moving right along. We have a update regarding for our friends at Public Health. It's really going to be more of question and answer because we've had a lot of updates and presentations, and of course, you've all seen the guidance document that released last week that covered the 5 areas. The main areas being social distancing, cloth face coverings, school health policies and PPE, screening and school exclusion, sanitation and environmental factors, and contact tracing. And so you've had a presentation from 3 other documents that take all of these concepts and incorporate those into other more detailed areas of school administration. And so I hope that format works for you. I did get a comment from a superintendent there's apparently the links are not working on the slide that I think it's slide 5 on the PowerPoint that lists all the reopening documents. If you go to the KDE website at the very top, there are 2 options. You can go to the main state government COVID-19 website, or you can click on KDE's COVID-19 site. And you can scroll down to the green button, and it's KDE reopening guidance. All those documents are located there. Robin Chandler, if you're listening, it may be best for us to also send an email to all superintendents with just the links of all those documents that we've referenced today, that we have up today on slide number 5, so they can just have that easy email reference can send to their staff. So if you all will make a note of that, we'll get that out to you to make that a little easier. Dr. White, before we start with questions, do you have any comments?
Yes, a couple of comments I thought might be helpful. On the meeting yesterday, when we talked with the task force, I had a question asked of me that one of the individuals said they had been on an NCAA call Monday morning, and that they had been told that the CDC was going to be changing some timing on quarantine and some comments on the efficacy of face shields. As the first commenters were talking, I looked again. My comment yesterday was the CDC usually doesn't consult with me when they make changes. I just learn about it like everybody else does. So I went to the CDC website, and as of a few minutes ago, no changes have happened. That doesn't mean that couldn't happen. As we've said all along, since this is such a new virus, it's only existed on the United States since end of February, 1st of March. Research is going on every day. New things happen every day. I think in March it changed sometimes twice a day. But right now there has been no change in that guidance. If CDC comes up with some data that can demonstrate any changes, not just to those 2 factors, but any factor that we have in the guidance, then Commissioner Brown and I have talked about, we can always have flagship 2.0 because we want to keep this document fresh and accurate and appropriate and not put any undue burden on your team if there's not any scientific backup for that. So I will keep my ears to the ground and alert the Department of Education the minute anything like that could change. And then I think it might be interesting, many of you are aware of the bar in East Lansing, Michigan. I've read a lot about that bar. They now have 107 COVID-19 cases from this bar that opened, and I only think it was open a few days. But it's very sad because it was a couple who had children. They had closed their bar because of requirements in Michigan. They had moved their tables 6 feet apart. They had marked the sidewalk out in front. They had done a host of things. They had spent some of their savings to do some things. And they opened their bar, and the next thing they knew, people were moving the tables on the patio up next to each other. They looked out on the sidewalk where they had marked the 6 feet distance waiting to get in. And when they told people, no, you have to stand 6 feet apart, the patron said, it's a public sidewalk. You can't make us do anything. And with that mindset, they now have 107 people with COVID-19. They're closed. And their comment was, we thought of everything, but we could not change human behavior. So I think that's what the commissioner was talking about earlier when he said using the summer to talk to parents, to get kids used to masks. I don't think you have to work very hard looking at the news to recognize when we don't do the things that we know, the basic public health tools of social distancing and wearing masks and washing our hands, we can get into some real trouble real quickly. So that's why you folks, since you are the leaders in your community and you're the role models, you guys make a tremendous difference in how this is going to go down, with you doing everything that's in the flagship document and all the other great supporting documents that have been put together. We need people to buy into this and be carefully informed that this is not an option for us. Unless we want those kinds of outcomes, we are going to need to stick to the careful plans that y'all are making. And it's impressive the amount of work this is taking you, but the number of people, not of cases you're going to prevent, but of lives as those cases go home and interact with family members. And as a 65-year-old, almost 66-year-old woman, I know you've got some teachers, some custodians, some value and treasured administrative staff that we're going to prevent them from getting this illness and potentially dying. So I just have hats off to you for all the hard work you're doing, and thank you for your cooperation.
Dr. White, thank you for that, for kicking us off in that way. That's certainly the challenge that's ahead of us. Our schools often deal with a lot of problems that come that are from the outside, and they bring them, manifest themselves with students. And this is, when we don't have all of society buying in, unfortunately, to this. However, there's some rays of hope out there that I'm seeing on the news nationally about masks, and we played the video on the governor's press conference last week that one of our co-ops developed a public service announcement, and we're hearing of other things going on like that. And I saw I think Old Navy now has a packet of masks that you can get for probably less than $5, and they're all in all kinds of prints. So all those little things hopefully will start moving us in a way where this is an expectation in our society. And we know it's going to be temporary. It's not going to be the rest of our lives, but something we've got to do right now. Related to that, I wonder, Dr. White, if you could also comment. You answered this question yesterday, and it's coming up again through some other superintendents that weren't on that call. In the call we're referencing was the Education Continuation Task Force that we had yesterday. Members, about 40 members, all the K groups, et cetera. And the question was about temperature taking and whether or not and why that is something that we're still doing and why it is necessary. If you can expand on that for us, I think that'd be helpful. And then we'll go to Tony for questions.
Okay, sure. Happy to. The question yesterday was, well, since people are asymptomatic with this virus, why are we even bothering to take temperatures? And if you look at, and I should know the page number by now, but there's the exclusion criteria that is in the flagship document of the kinds of things that would keep kids from coming to school. And if you look at those in the literature that I can find, fever, temperature greater than 100.4, is the most consistent of all of those symptoms. So most people have some elevated temperature. They might have elevated temperature and cough. They might have elevated temperature and rash. But the vast majority of the people that have symptoms will have fever. So if you can catch this young student or this older student at the door with a temperature of 100.6 before they start feeling sicker and start manifesting some symptoms at 2 o'clock in the afternoon, then you have kept that student or that faculty member, staff member, from potentially spreading that viral infection. It spreads quickly, and it is pretty virulent. So getting them as early as you can, and you can't catch somebody before they cough, but you can catch them on that temperature elevation that goes up, and it evidently is a pretty quick trajectory for a lot of people. The question was very good that 20 to 40%, depending on what population you look at, 20 to 40% of people with COVID-19 don't have symptoms. That's why I'm going tomorrow to get my test done. I have no symptoms at all, but I want to go and get that done periodically to be sure. So 20 to 40% of people don't have symptoms. Well, if you do that math, and I know I'm in public health, but that means 40 to 80% of the people do have symptoms. So yes, there is a group that you're going to take their temperature and they're going to get COVID-19, and they're going to be a case that you're going to have to deal with in your school. But 60 to 80% of the time, they're going to have some type of symptom, and most of the ones that have symptom, fever is going to be one of those symptoms and one of the earlier symptoms they're going to have. So I hope that kind of explains that a little bit. It's a good question.
Yes, thank you very much. Tony, you want to kick us off with, I think you have an announcement or two about some posters, and then go start with the questions?
Yes, thank you, Commissioner. So I also wanted to just let all of our superintendents know that we, I think last week, if you were watching the governor's announcement, you saw the Healthy at School document that he held up. And I wanted to let you all know that we are going to be sending that out to you. You may have noticed that it may have been more towards perhaps elementary age children. And so when I signed in this morning, I took a day off yesterday. KY Stats had sent me actually a version that will be good for high schools, for high school student age children. In addition, we are working with Jefferson County's Language Services Department. They are translating that poster into 4 other languages. And then we expect to have that probably by the end of this week. We also at the Department of Education are picking up the cost of translating the actual document, the 24-page document, into the 4 other languages as well, and expect to have that out for your families no later than July 7th. So the 4 languages other than English that will be provided are Spanish, Arabic, Somali, and Nepali. So there'll be 5 total languages for the posters, and every one of those posters will be available to you for download. You just be able to download those. You can make them onto paper size, poster size. You can laminate them. Those are something that KY Stats did as a team effort with us in the Lieutenant Governor's office, just for you all to put up for display in your schools, to send out to your families as an attachment to emails, just to kind of help with the communications. And really it talks about those 5 areas and just helps with the communications effort. So I hope that those posters will be helpful for you, and also with the translation in documents. So hopefully as soon as we get that information to you, we will get those out. You will get an email from either myself or the commissioner here within the next week. And with that, we can go to the questions. Okay, here is the first question. With the mask and social distancing requirements to start school, how are we justifying moving forward with athletics? Is KHSAA required to follow the same rules? We are in need of some consistency, they say.
And I have to confess, I do not know KHSAA and where they are with that now. Commissioner, do you have any more information? I know they started with athletics early because athletics needed to do some pre-training. You don't want to start cold with an athletic program. But do you have any insight on that?
I don't know where we are. I know I'm not sure if Commissioner Tackett is on today or not. Commissioner Tackett and KHSCA, they are working with public health and the governor's office about guidance specific to athletics. So those are playing athletics and sitting in a classroom are apples and oranges. And so there are going to be certain things that will be allowed in one that's not allowed in another. There will be certain things that may be allowed, such as low contact sports, that aren't allowed for greater contact sports. And so KHSCA, they are working on that. I don't see that as conflicting with the guidance that we've been given. It's my understanding that that is going to be specific to each sport and each activity. And also, of course, based upon then get into the governor's requirements for the group attendance at certain events, all of that applies as well.
Yes, we have seen, and I've signed off on some of the low impact of the single sports, I think tennis and cheerleading, and there have been a whole host of things that have been approved, but I think most people are thinking football, and I don't know what the rules are going to be on that. I know the SEC is looking at that, obviously the NCAA is looking at that, and I've seen no documents that I could even react to, so I'm sorry I can't be of any help with that.
We will make a note to have Commissioner Tackett on for the next week's superintendent webcast. I think he was on several weeks ago. It's probably a good time for him to come on. So Karen, if you could make a note of that, we'll add that to the agenda for next Tuesday.
Yeah, I think Julian had said he was not able to join this week due to a conflict with meetings, but that he would be available, I believe, next week. So we can just follow up with him and make sure that that's still possible. Sure. And we can add him on to the beginning of the agenda, hopefully. All right, so the next question I have is, will there be specific quote unquote mask waiver criteria provided from the state that will require students to medically qualify?
We talked about that. Did we want to put a listing of if you have these 5 things, then you are waivered? And we decided between Department of Public Health and working with Kay Kennedy and Robin Kenny and all the folks and Angie McDonald, as sure as we listed 5 things, there'd be a 6th one we didn't think of. We felt like that, it's going to be children with respiratory issues, asthma. It's going to be adults with COPD. It's going to be anything that's going to, that cloth up against their face is going to cause a problem. There are going to be issues with special care needs children. So I know the commission, no, it's not the commission anymore, it's the Office of Children with Special Health Care Needs. They've come up with a document about, for children with autism, about the types of masks that you can offer them and the ways that you can help them pick their masks out. You're going to have some children with some anxiety issues. So I think we felt like that list was so intimate for each individual student that providing a list would probably defeat the purpose and cause more issues than if we had people use professional judgment on that. We could try to come up with that list, but I really think that would be fraught with more problems than it would be appropriate for. So if I had a child with an issue that I was concerned about, I would contact their provider and say, I need a note so that I'm sure that, little Kevin here is not going to be forced to do this because he has XYZ disease. And I know he can't do that. And if you've got a provider that agrees, then you got your documentation as a parent. Or if I'm a teacher and I know I have COPD, then I think I need to be sure. Now, the question that we talked about was, if I'm a teacher and I'm not wearing a mask, people are going to say, well, what's wrong with you? That's kind of up to me to tell you, well, I have lung cancer. You're not going to want to do that. I think just saying I have a medical condition that prevents that. And then after that, it's really not anybody's business as long as it's cleared through their administration.
So on that note, Greta, are you on? Greta Hilton?
I am. Can you hear me okay?
Yes. Can you talk a little bit about just the importance of highlighting the ARCs and being involved in the decision making for students with disabilities?
Sure, thank you. So just quickly, when you're thinking about the wearing of masks or anything of that nature for students with disabilities, it's important that the Admissions and Release Committee, or ARC or ARC, be involved in the decision making for all of those students. So for example, students that have disabilities that might be on home hospital instruction, while the vast majority of students may have to have a medical note, and that's important information for the ARC team to consider. I think the same thing would apply for students with disabilities as far as masking. You obviously want to have all of the data. You would have to have information to make that decision, but the ARC team must make that decision, because there are times that parents may not have the ability to get the student to a hospital or something, but you would know, because you would already have, as the school or district, you would have the information on the student's medical condition and or other conditions that are medical, but that we may not see quickly, like Dr. White mentioned around students that have autism or sensory disabilities, or even students who may have behavioral or emotional disabilities as a result of trauma or things in their lives that you don't see when you see a student. And so I think it's just very important that we have the team that works with that student most closely involved in the decision making.
Okay, sounds good. Our next question, if a district is trying to have all students who want to resume 100% in-person class, can that be the reason to use distances less than 6 feet in classrooms with masks required?
Regardless of everyone's decision, the 6 feet is the safest distance you need to be away from someone, so those respiratory particles don't land in your space so that you can breathe that in and give you this respiratory disease. So the decision making and what's happening in the world does not change that 6 feet. Sorry.
Okay. The next question is, we suspect that we will have staff who would like to work from distance. What are we allowed to require from staff to justify this request?
That's a KDE answer.
Todd, do you want to jump in here? I think part of that is just local decision making to determine if you have employees that are able to work remotely to do their job function. That obviously reduces the number of employees that may be in your central office. There are very few employees in an actual school building that when we have students present that I think would qualify for that. But I think the first thing is asking yourself, if you have employees who can perform their essential job functions remotely, if yes, and you need to decrease the amount of people in your central office space to achieve 6 feet social distancing, healthy at work, etc., then I think that's the first step in that. Do you want to take it from there?
Sure. I agree with you, Commissioner, that the first step in the process would be for school districts to look at the position itself to determine whether or not it qualifies for remote working. That is, whether or not the employee can perform the essential functions of their job remotely or they can't. We can certainly think of positions within school districts. A back office position may be able to perform their functions from home with a computer and internet connectivity, whereas an individual who's expected to come to work in the cafeteria and prepare food would not be able to do that work remotely. So the first step is to look at the position and whether or not it would qualify for remote working. The next steps, if it is a position that would qualify for remote working, then the question about documentation gets into several factors. Number one, if the employee is utilizing leave or, not utilizing leave, but if they're requesting some type of emergency FMLA through the federal law, then you would look at the type of documentation that's required thereunder. So, for example, one of the one of the provisions indicates that a doctor has indicated to the individual that they should not come into work. If that's the case, then you would ask the employee to provide that statement from their doctor, just like you would under normal circumstances if they requested some type of job accommodation. So I would encourage you to take a look at your policies. We can recirculate that information that I provided a few weeks ago regarding the emergency FMLA under federal provisions to help with your decision making in that regard. And obviously, as I always do, recommend that you contact your board counsel to look at how you're going to handle situations when employees request essentially an accommodation of working from home under these circumstances, and whether their medical condition warrants granting that.
And I may be way out of my lane, but I remember one of the state documents that I read as we were working on our flagship document was talking about, again, you've got Miss White who teaches something, who's 66 years old with rheumatoid arthritis. She may be your perfect person to be teaching your NTI classes. So that's a way to keep her out of the mix and then get the other things you need. Now that may make no sense at all, but I did read it somewhere, so I'm throwing it out there.
And
Okay.
Tony, before we get into another subject, and this is going back to 2 questions ago about the 6 feet social distancing question, a clarification for a superintendent, and Dr. White, correct me if this is inaccurate, but you can still have students in a classroom less than 6 feet if you can't get to that optimal social distancing or beyond, as long as they are masked the entire class period. Is that correct?
Correct. Yes. I'm sorry. I misunderstood the question. I apologize. That is correct.
Okay, the next question is, will guidance from DPH change since the release of the American Academy of Pediatrics considerations for returning to school?
And I have not seen that document, so I can't respond to that. But I will. And if there's something in there that we need to change, well, as I said earlier, we will continue to keep up with the science that's recommended. So I apologize. I've been out with some family issues and haven't seen that, but I will find it.
Okay.
So Tony, again, I got another clarification regarding this 6 feet. So I think what Dr. White is saying in public health, and we're saying in our document, that the optimal situation is to have a class where you can have the 6 feet social distancing. You can calculate that by a square. You can do the radius of the circle. I think the radius gets you a few more students in your classroom, or beyond, or greater than 6 feet. However, we have the allowance and the flexibility that if you cannot achieve that social distancing in your classrooms, you can go less than 6 feet so long as students have their masks on during class. Now, if they're 6 feet or greater apart and you're maintaining that optimal social distancing, their mask can come down during class. And so districts are going to have to weigh the pros and cons of all those scenarios. The con to having everybody back and somewhat having the same density that you had last year is that everybody has to have a mask on. And so if they're going from class to class and there's 20 to 30 in every class, you could have a kid that has a mask on all day long except for a small time when they're eating. That is, been cited as a concern for some parents and others. If you have the ability, you have a building that has additional space and you're able to do alternative scheduling and you're able to loosen that to at least kids are in some classrooms where they can lower their masks, that would be ideal. Obviously, to make the 6 feet social distancing work for everybody where masks come down during class, you're going to have to do some type of hybrid scheduling probably, unless you're just sitting in a huge building that's greatly under capacity, to have, as we've talked about, the A and B groups of kids coming in alternative days, those types of things. So all of those are okay. There are pros and cons to all of those situations.
Okay. So there was a quick follow-up that just said, can we have a specific, I think it is in the document, the 6 foot can we please have the 6-foot rule clarified in writing? And so I think that's where Kevin is coming from. So to answer that question, that is covered, correct?
Yeah, I believe it is covered in the document. It may not be described as I just described it, but yes, it is referenced in the Healthy at School document. If you still have concerns about that and you want something from me saying what I just said, I'm happy to send an email out to superintendents that says that. And I've also heard from a superintendent or two that talks about, we arrived at this decision in cooperation with public health about allowing you to increase the density of your classrooms if you wear the mask, because we heard from superintendents this is what you wanted. You needed that flexibility. You wanted to be able to make that decision. And I'm hearing now from a few of you that you want it to go the other way. You worry about, is one riskier than the other? Well, ideally, it is best to have 6 feet social distancing between folks, but we have consulted with public health. They have made the determination that under those circumstances in a classroom environment, as long as you have your mask on, that is going to be okay. So, with any of these types of solutions, there are going to be pros and cons. And, if you really want to reduce risk, we would go to complete NTI. And I don't think anybody wants that. I know some schools are starting off that way, and I don't see anything wrong with that, particularly as you're getting your community adjusted. So I understand the concern out there, but know that when we try to offer this flexibility, we are offering the flexibility. It was because we heard from the field that this is what you needed, and you wanted to have those options that you could do what you thought was best for your community.
Okay, so quick clarification on masks. Will the paper masks, which are similar to the surgical masks, are those considered the same as cloth masks, and are these acceptable?
I'm not sure what the paper masks are. If the question is, can surgical masks be used? They can be. I mean, we have put cloth throughout the document just so that we weren't using up surgical masks that could be needed in a healthcare setting. Obviously, back in April, that was vitally important because our PPE supply was so poor. The supply chain is better than it was, but we still have institutions that can't get surgical masks. So I would certainly lean away from that just for that reason. It has nothing to do with safety. But if it is a paper mask that's equivalent to a surgical mask, I would say yes. But not knowing exactly what they're talking about, I'd be hesitant. But I think they can get what I'm trying to say is if it's as good as a surgical mask, that's a little bit higher protection than actually a cloth mask is because it fits differently on your face. But that would be acceptable if it's surgical mask equivalent. Yes.
Okay.
And I really encourage people to let the kids design their masks because you're just always prouder of something you've done yourself, and you can make it a contest. I think you might find some good buy-in from that. Again, that's out of my lane, but I'm just, as a grandmother, I'm just throwing that out there.
Okay. If implementing an acknowledgement to perform daily personal health assessment, parent measures the temperature daily, would the school still be required to measure the student's temperature on campus before entering the school building? I believe the answer to that is yes.
Yes.
Okay.
The parent attestation was a way to try to prevent a line of children getting on a school bus. Best practice, in my opinion, would be you'd have a bus monitor, you'd check that temperature before they got on the school bus, and if you do it there, then that busload of kids can go right into the class, into the school building and not have to have their temperature taken. But with the fact that a lot of schools don't have monitors, the fact that you don't want your bus drivers taking temperatures, even though it's a pretty simple procedure, taking eyes off the road, that is way more dangerous than I ever understood. I've learned a lot about education in this process. So in order to not have that backup at the bus stop, then if the parent says, yes, my kid is safe to go to school, they can get on the school bus get to school and then have their temperature taken. The disadvantage of that is if that child does get to school and then does have a temperature, it doesn't mean the parent fibbed about it. As I said, that trajectory for fever is pretty rapid. So there's, maybe the temperature did go up from, you said some kids are riding the bus for 40 minutes and if they've been waiting for the bus for a while. So if they do have a temperature higher than 100.4 when they get to the school building, then you're going to have to, if that child has COVID-19, and they could have a fever for many reasons, but if they do turn out to have COVID-19, then that whole bus that they've been around will be part of the contact tracing. And then let's take that a step further. Let's say, little Kevin gets on the bus first and he's on the back row, and little Connie gets on last, and she gets to school and she gets off the bus first because we're unloading from the front, and little Connie has a fever. Well, I've been on the front row, not facing anybody for 20 minutes. Little Kevin in the back of that bus is very likely, he's not going to be a high risk, even if little Connie does have COVID-19. So there's a process to say, this is a group of concern, and then you would work through, okay, what happened on that bus? Did the kids suddenly have a free-for-all when somebody released a puppy out of their backpack? I don't know, I'm making stuff up, but as long as little Connie was in the front row of the front 3 rows of the bus and had no interaction with little Kevin in the back, then I'm not saying the whole bus has to be quarantined. I'm just saying that group of children will be looked at, or students will be looked at. Are they high risk or low risk? Did that make it more complicated, or did that make sense? Okay, good.
Okay. While we're talking about thermometers, I wanted to see if Robin Kinney was on the line, because she has some good news to share, believe it or not, on the thermometer issue and some no-touch thermometers. Robin, are you on?
I am. Thank you, Tony. Hi, everybody. It's nice to be with you. It's always good to be able to share some good news. In my world, where we're always talking about money and not having enough of this and that, PPE is one of those things that I know school districts are very concerned about, and included in that are no-touch thermometers. So here at the Commonwealth, as we've been working very closely with the Department for Public Health, Emergency Management, and even the Kentucky Transportation Cabinet, we received word yesterday that school districts will be afforded at no charge, no-touch thermometers, and we'll have about 12,500 that are going to be allocated to local school districts. The way we would distribute those and allocate them, loosely based upon the number of schools and buses that you have in your district. And we'll work with the Department for Public Health. Those thermometers will be at their distribution centers. We are working today in trying to match up districts with ad regions, which is where they have these thermometers stored. And then we'll ask districts, we will provide information to you that tells you how many you will receive as a district and how you will pick them up from those regional ad distribution centers. We'll have the location, and Public Health will help us to schedule pickup times for you. So we know that this amount won't cover all your needs, but it's a great way to get us started. And then the other plug I want to put in is, so we really, really appreciate the continuing coordinated efforts on behalf of Public Health, Emergency Management, and the Transportation Cabinet. And then we also, as a reminder, we had a guest on here maybe last week or the week before from Emergency Management. He was speaking to us about FEMA. So that is another way that we'll be able to seek reimbursement on behalf of local school districts for more PPE, including more thermometers that we think you're going to need. So I just wanted to share that good news with each of you, and we will be providing more details about that once we know the allocation per district and the location sites for you to pick those up and the scheduled dates.
I was horrified on one of our earlier calls way back at the beginning when somebody said, well, our thermometers are back ordered till November. And I thought, oh, no, we can't have that. So I don't know if that's still the case, but we were able to scarf these up for you guys. So I'm excited.
Appreciate it very, very much.
Great. So in case you guys missed that number, that's 12,500, correct, Robin?
That's correct.
Okay. And we'll provide information in today's press release from the superintendent's webcast that you will receive later this evening about that. And then, as Robin said, we'll make sure that you get that information as soon as we have it in terms of how you can receive those thermometers. The next question that we have is they're wanting to know, do the guidance documents supersede other laws and regulations? So examples, they would be Senate Bill 1 with the modification of bus guidelines.
I can't answer that, sorry.
Todd, I don't know that they're.
I'm not quite sure I fully understand that question. We'd have to look at that a little bit more, but the document that's been issued is neither a statute nor a regulation. It is the expectations that are set forth by the Department for Public Health and the Department of Education for opening schools. However, they are not statutes that have gone through the process of approval through the General Assembly or a regulation that has gone before the State Board of Education through that process. So it would not be statutory or regulatory in nature, but instead expectations that are set forth by the Department of Public Health and Department of Education.
Okay.
This is Robin. If there's something that the person who's asking the question wants to specifically send to us, it appears the question is about something to do with school buses. So, and Senate Bill 1. So if they could send that directly to myself, then I'll make sure that we take a look at it.
Okay. So the next.
An example where guidance can conflict with other guidance or regulatory responsibilities. We've talked in previous webcasts about, for example, some discussions that were had about opening doors, leaving windows open for ventilation, but then you also have some safe school guidances out there that say the opposite. And so, and John Akers, his team, Marshall Wilcox, we're all working together to identify issues that could be in conflict. So, there could be things that are in conflict for this limited period of time, and we're going to work together across agency to work out what's the best scenario while we're in this pandemic.
Okay. The next question I have is they're saying that they would like some certification flexibility. And is this a possibility? If they do an A-B schedule, they need to hire some teachers to work with students who are on NTI while the regular teacher works in classroom. So question on certification flexibility.
Yeah. Hi, this is Rob. I'm on the call. Hi, this is Rob.
Can hear you.
Okay, you got me? Okay, thanks.
Yeah.
So our office has been game planning this with some input from superintendents and some co-ops. We're putting together some options right now to see what we can do along the lines of potentially having a teacher who has middle school certification being able to step in and teach content up through 12th grade, or a high school teacher with high school content down through 5th grade. Maybe the possibility of blanket waivers on an additional emergency certificate for teachers who are emergency certified out there who might need another year, and that wouldn't go against their number of emergencies. We've got some other things that we're vetting right now and hope to have that back to you in a week or two, but we absolutely understand the need for that flexibility and hope to have that to you soon.
Okay. The next question we have is that some districts are saying that it's difficult finding and obtaining truckloads of sanitizer that's needed for the upcoming school year. They're wondering if the governor/state/KDE can reach out to distilleries to mass produce quantities for school districts.
I do know that at the very beginning, when the distillery started making that, there was a link on the COVID-19 website where you could request it at a pretty inexpensive rate, but I've not heard anybody mention that lately, and I certainly haven't heard anything said about schools, but that's certainly something we can check on.
Hey, Tony, this is Robin. We'll check with the Office of Procurement Services at the Finance and Administration Cabinet and see if they're hearing anything about reduced quantities of sanitizer. Of course, local school districts can purchase off of state master agreements. So let us take that one and look into it and see if we can find out anything more that we can share.
Here's my Jephthah Creed sanitizer that I keep on my desk just for conversation. It really is hand sanitizer.
The next question that we have that I would like to talk about is in regards to duty-free lunch. It's been brought up a couple of times in previous webcasts. It's been brought up a couple of times here. The note says, we are concerned about meeting the law requiring a duty-free lunch for our teachers and meeting requirements for classified staff as well. This is one of the current barriers in providing supervision of all students if students are to eat lunch in their classrooms. Any advice would be appreciated.
Well, we stated earlier, or maybe it was last week, that we wanted to continue hearing from you, and as you start planning the school year and start looking at staffing schedules, to let us know if it is you think it will be a problem. And so it sounds like for that, at least for that district, it is. And so while we will have a package of emergency regulations, and we did have a memo signed last week giving some relief, that doesn't mean that's the last time that can happen this summer. And so this is something we want to hear about. I'll go ahead and talk about this. We've got a request from a superintendent and some others to have a short survey about how you plan to reopen your district in your school, how you're going to open your district. Is it going to be all NTI? Is it going to be a hybrid approach? Are you going to put full capacity with all wearing masks? And so we're going to send a survey out, and I'll just throw this out there, Karen. It may be good for us to also survey about the duty-free lunch issue to see if that's going to be a problem as they're starting to plan for the next year and look at staffing levels. And then we will take a look at that and then can determine whether or not any additional relief is needed in that area. Todd, Robin, you all have anything to add to that?
This is Robin. I would share that just as a reminder to superintendents and principals that the statute about duty-free lunch says that teachers cannot be compelled to perform those duties. Of course, they can certainly agree to do so. And then I have also heard anecdotally that a teacher can trade lunch duty for bus duty, for example. So I know some of those creative things are already going on in districts. Just wanted to make sure that we remember that.
Okay. All right. Next question we have is, will requests for waiver of approval for only 3 emergency days be expanded when employees are required to be quarantined?
Todd, can you comment on that one?
Sure. During one of our previous webcasts, we addressed the leave provisions that are set forth in statute for school districts. Currently in statute for emergency leave, the days that can be provided to employees is limited to 3 by statute. So that is a school board can't take action to grant more than 3. In Senate Bill 177, the General Assembly provided some flexibility around that and allowed school districts to grant additional emergency leave days for the 1920 school year. However, now that we've concluded that school year, that's no longer in effect. I will also note that the school districts currently, as it currently exists, can local school boards can act to grant additional sick leave pursuant to statute. So the number of days set forth in statute, they have to grant at least 10, but they can grant more than that. Emergency days are different. So that's something that, obviously we would want to hear from superintendents and school districts on whether the need exists for some type of waiver around emergency days, knowing that districts currently have the ability to grant additional sick leave days. And there are also provisions in federal law that provide for additional paid leave, even sometimes if it's reduced paid leave for school district employees.
Okay. The next question I have, I'm going to try to combine two because there was two that are kind of going together. Should districts consider requiring staff to be tested for COVID before returning to work? And then there was also a question on whether we were going to, or the state was going to issue guidance on that 10% figure that Governor Beshear had announced last week. Commissioner, did you want to talk a little bit about that, just in case they didn't tune in?
I'll just briefly comment, and now Dr. White can talk in addition. The governor had mentioned a broad goal. I don't think this was in the term of a requirement at all, but a goal for districts to shoot for having 10% of your staff tested a week. And I'm sure that's in keeping with some best practice guidance applicable to other sectors and workplaces. And so we repeated that, and we will be encouraging that. It's my understanding that the test is covered. I've been tested. It was covered under our state employee insurance. It's my understanding will also be covered for school district employees. And so we obviously want to encourage that because that's obviously part of the strategy in reducing the spread is testing. And so, Dr. White, do you want to take it from there?
I don't have anything to add to that. I think, again, going back to that 20 to 40% of asymptomatic, to protect your coworkers and to protect your students, I think that's a reasonable goal. We don't have that in state government. I'm surprised. Maybe they haven't thought of that yet, but I think we will, as we go through this year, and if numbers go up as we are seeing around the country, I would not be surprised if that would. I don't know that you can make someone have a test, but I certainly think you can highly advise it. And as I've said on these meetings before, I want a mask that I can wear a button that says I'm wearing my mask because I care about you. I think that's also what your testing is going to do, because certainly if you are positive and don't know it, you want to isolate yourself so you don't make anyone sick.
Okay. Question on whether KDE will be sending out a superintendent survey asking what everyone's first day of school will be as of today.
We're certainly open to do that. Right now, we're gaining in the number of questions on the survey. I think we're up to 3 now, and there's nothing wrong with that at all. I think if you superintendents think that would be helpful, we can do a Survey Monkey from here and get that information to you very quickly. And it sounds like that it will be, from what I'm seeing on text and otherwise, helpful.
Okay. And then for clarification, is it an option to allow classes to have students closer to 6 feet as long as they are wearing masks?
Is it advised or is it allowed?
Is it allowed? Can they be closer than 6 feet as long as they are wearing masks?
Correct.
Correct. Okay, next question is, where can the student capacity calculator be found? And I believe that is in the guidance document that we released this week on facilities. Is that correct?
Yes, this is Kay. That is a separate document that is actually listed on the in the group of documents on the KDE website for reopening. It's a little separate sheet, but it's also linked within the document. So I think I clicked on it today and it looked like it asked you for a password, but you just canceled that because there's no password protection on it. But it should be out there and available. If you have trouble with the link, shoot us an email.
Okay. All right. So the next question is related to CTE. Will the issue of CTE classes taught virtually be addressed? Will they meet the criteria toward credit at the high school level if taught virtually?
So this past so many months that we've been in this, those counted toward it. It's the lab courses is where we get into problems. But we are currently working on creating some hands-on type activities and some kits that can go home with students to try our best to shore up any holes, I guess you'd say, in that And it is our hope that we can get in there, but in the event that we can't, we'll continue to work on project-based learning activities and activities at home that we can shore up as much as we can in those areas.
Okay. Can school districts look at sorry, let me start over again. Can districts look at live streaming the class for the kids that are at home that week to combat the issue of not having enough teachers, which would also help us help us with the additional funds?
So yes, you can live stream. I'm not sure if this is getting into a certification area or not, Rob. If so, chime in. And I neglected to mention early in the webcast, we kind of glossed over the memorandum that was issued also in conjunction with or at the same day, on the same day as the Healthy at School guidance. But as you know, we issued a memorandum signed by the Lieutenant Governor, and it went to you, and it was pursuant to the governor's emergency order authority under the Executive Order 2020-243 that was issued in March. And so we suspended through that memo the restriction on the number of NTI days. And then we also are decoupling attendance from funding temporarily, so you can educate a student at home, even though that student's classroom and classmates, the majority of which are going to be in your classroom, social distancing and being educated in class. As we've talked before, the current system didn't even contemplate that. It was either everybody's in school with a few on home hospital, or everybody's doing NTI with a few on home hospital. And so the funding is going to flow to you based on that effort through that memo. Now, we're going to be, the memo only suspends the laws. We'll be having a Kentucky Board of Education emergency regulation that we believe will be reviewed by the local Superintendents Advisory Council on, I believe, July 9th. You all may not know that yet. We're going to try to get you in on July 9th for a quick meeting to just look over that E-Reg. And then the state board hopefully will have a special meeting around July 10th so we can have that emergency reg. So the emergency reg puts in place the parameters for the NTI and the funding and attendance, and the memo suspended some of the suspended in a limited number of statutes to be able to give you this flexibility.
Hey, Kevin,
Ron, did I miss anything on you could get into some certification issues possibly on that question?
I'll just add this. As far as streaming goes, we do have guidance out there around what a digital curriculum looks like on the KDE site. However, if you're running some sort of a hybrid situation where you've got half of your kids in and half at home, and you're streaming to them with the teacher of record, that's absolutely fine. If you're using another blended approach, whether you have a teacher who is delivering some other content that's on a platform like Summit or Apex or Edgenuity, some of those, that's permissible as well. There's also, if you're looking at having to socially distance your kids, you can still have the teacher of record be responsible for the content and curriculum, but have another certified teacher serving as a facilitator of your kids in another room simultaneously if you need to. So again, those are great questions. I know you're going to have to really be flexible in how you look at dividing your kids, maintaining the social distance, but also trying to get as much synchronous content to them as you can. And that's also something that we're working on putting together in our guidance for you guys as we look at what kind of flexibility and waivers you need. Does that help, Kevin?
Yes, I think it does.
Okay, next question is, our families want to have all students who come to school wearing masks. Are we allowed to offer this option even though in the document it states we must reduce class size?
So the document does talk about reducing class size as an expectation, and I've described this as the first step you need to look in your building is, can I reduce class size? Do I have a classroom that we used as a storage room? And I know this is very rarely happens because most of you don't, right? You need space. You don't have extra space. But the first option is go through, do I have some places where I can spread my classes out to try to reduce those class sizes? That's the first thing you need to go through. That's an expectation that you try to go through that exercise. Knowing, however, if you can't do that, or if you choose not to do that because of the trade-offs we talked about earlier in the webcast, it is permissible to have students in a classroom environment closer than the 6 feet, as long as they have their mask on. So I think the question, though, was about a family that insisted, was that it, on having their students with a mask on?
Yeah, looks like they had surveyed families, and they want students with masks on.
And that's a local decision. What public health is saying, that from the public health risk, if you are beyond, Dr. White, you're becoming an educator. I'm becoming an amateur public health person here, so you're going to have to jump in if I'm wrong. Public health, they're saying that it's okay to drop your mask if you're 6 feet or more in social distancing. I don't see anything wrong with a school deciding, or a district, but a school deciding, we want to have everyone with a mask on, even if you're 6 feet apart. That's just an extra layer of protection. Is that fair?
I think that's very reasonable. And I would say around this building, except when I'm sitting at this desk like I am right now, I have my mask on all the time, walking in the hall, even if I'm at a meeting. I mean, I don't take a yardstick with me. I kind of know, my husband's 6'2", so I kind of have an idea of what 6 feet is if he was laying down on the ground between who I'm talking to. But the mask up and down for me is much more distracted than if I just put it on. When I get up from this desk, I put it on. I wear it all the time. That's a personal choice for me. And if a school wants to do that, to add an extra layer of protection, I think that's their decision, and I would applaud that.
All right, the next question is, can we use acrylic/plexiglass specially made safe dividers with the same students sitting in the same place and clean frequently to take the place of masks when students' desks cannot be 6 feet apart?
Now, we talked about this way early with Robin and Kay and Angie and our environmentalists, and there were 3 things they were concerned about. One was the cleaning. That would be a lot of effort, and if you ask the students to do it, I don't think that would always give you the result you wanted. The second thing that our environmentalists were concerned about is the security of those things being secured on the desk, and the chance of them falling and causing injury to the students. And then the third one, which still gives me pause, is if you've got a plexiglass thing sticking up out of the desk, and you've got one over here sticking up out of the desk, and kids are horsing around and someone falls, an injury to them, and especially an eye injury to that person, even if it's not a sharp, pointy thing, even if it's rounded, the risk of injury is with a bunch of rambunctious students, I think is all 3 of those things made that an option we did not feel was safe for a classroom of students.
Okay, the next question is, it is nearly impossible to not have students congregate at arrival and dismissal times. Can students be in a larger room, such as a gym, with masks on to dismiss/arrive without social distancing?
Well, they still need to social distance, but it would certainly be a lot easier to designate them to places in a gymnasium than to try to get them to stand in line 6 feet apart. I think the social distancing is the key, unless they're wearing their masks. And how you manage that social distancing, whether it's in a large auditorium and you've got people spaced out and there's marks on the bleachers, you can sit here, or you mark your sidewalk where they're standing. But I think those are your creative ways to figure out how to keep them separated for the temperature checks.
Kevin, this is Kay. With regard to managing crowds and movement and distancing, I would say maybe look at how Disney does it. with their lanes and the back and forth that the lanes use. You could set that up fairly easily in a gymnasium that students could wind through and maintain social distancing to the greatest extent possible. But certainly there are ways that you can move crowds of people without them congregating at a single location.
And I would also add, I had a conversation with the general counsel this week of Fayette County Public Schools, as well as Superintendent Kalk. And as you know, Fayette County, and I know some other districts have done this, but Fayette County implemented metal detectors in all their schools several years ago, or at least I think in all the high schools. I'm not sure if it's all now. But, there was a learning curve there about how do you process that many kids coming into the building, and so they learned a lot from that, and they reached out to Rupp Arena, for example, and Lexington Center about crowd control and how do you process a lot of people in a short amount of time. And so they gave me permission to mention Fayette on the webcast, and if you all want to reach out to them, particularly larger districts, about some of those lessons learned there. And I know other districts have had to do some similar things we might be able to learn from those types of situations.
Yeah, if anybody's thought something through, Disney has. So they're a good group to model.
The other thing to keep in mind is it's going to be a change in behavior, a change in expectation. Many times when the bus pulls up, the students are up and they're ready to get off the bus and the bus unloads. It may be similar to, when a plane pulls into a gate. If the gate attendant's not ready, you don't get off the plane yet. And we don't want to keep kids on the bus at the same time. We may have to have some gating procedures, particularly knowing that students are going to be cycling through to have their temperature taken. So all those things are going to have to be considerations in your timing and schedule.
And if you have someone who can stand there as they get off the bus and take their temperatures then, and they can go straight into the school building if that's possible. I'm trying to think of as many different ways that you can figure out how to do this.
Okay. There was just a question about, I guess, Dr. White, if you can distinguish here, because I'm not entirely sure this is correct. They said there's documentation that has been provided that wearing a mask all day is, quote, bad for you. How do they get parents to buy into having them put on a mask on a child for the entire school day?
I guess I would need to see that documentation. Certainly, if you go to a hospital, there are people in N95 masks that wear those for 12 hours a day for their shift. You want to try to not let the mask get wet, but I can't imagine how it would get wet in a school setting. So I really can't answer that because I'm not sure what they're talking about. If I could get that, I'd be happy to look at it and address that at the next meeting.
Okay. Tony, this is Kay. And again, from a logistics standpoint, I think it's important for school districts to consider ways that they can build time into the schedule where students can either through a relocation process or recess or whatever, have a period of time where they could be in a place in the building where they can be separated and remove their masks to get a break. So again, when they eat lunch, there's a break. When they, if they go to recess, there's a break. So just try to be creative and come up with ways that you can have a break on wearing the mask.
Okay. All right, just wanted to do just a quick time check. It's about 4:08, and we just have a few more questions. Kevin, did you want to just have me kind of go through all these, or do you want to stop?
I think I'd like to try to get through them if we can, Dr. White. I know if you have another engagement, you can feel free. If you can stay, that's great.
I can stay.
We've been able to get through all the questions every week. So let's see if we can do it this week.
Okay, the next question is if a student refuses to have their temperature taken or wear a mask, can we refuse transportation?
Todd? Even I know to call on Todd for that.
Tony, will you repeat the question for me?
If a
Caught part of it.
if a student refuses to have their temperature taken or wear a mask, can we refuse transportation?
So I think the temperature issue probably, since those are touchless thermometers, I'm not sure that that's as much of an issue. Refusing to wear a mask, I think, may be more of the issue that you would be concerned with. And we've discussed that previously in terms of, first of all, with regard to transportation, the bus drivers having masks available to offer to the students who have either lost a mask, don't have the ability to purchase one, left it at home, whatever the case may be, to offer to that student and instruct them that they should put it on to board the bus. Obviously, if the student has some type of medical exemption that the district has documented and the student is exempt from wearing the mask, then that's a non-issue, and they would certainly be permitted to board the bus without the mask in that situation. We talked about the situation where a student or a parent refuses to wear the mask, and a lot of strategies that could be implemented at first to try to address that situation, such as explaining the importance of the mask to the student, contacting the parents and explaining the expectation to them that the student wear the mask and the importance of doing so, the expectation that all students, unless medically exempted in the school, have a mask on at certain points, including whenever they're riding the bus. If the school district simply can't gain compliance, then with that expectation, then they may need to look to alternate means, including some type of disciplinary measure or compliance with their code of acceptable student conduct. But I would think that they would start at the bottom first to ensure that the student has the mask, communication with the student, communication with the parent, and I think that they're going to find that in that situation, most students are going to comply. We've indicated before that we wouldn't abandon or leave any student at the bus stop. So obviously, if the student presents and does not have a mask at that point in time and refuses to put one on that the bus driver offers to them from their supply that they have on the bus, then I would not recommend leaving the student at the bus stop, but instead going ahead and providing some strategic seating to the student on the bus so that perhaps they would be in less of a situation to infect other students on the bus, assuming that they may be positive for COVID-19, and then start working through those processes with building administrators and teachers to communicate with the student, communicate with the parents, try to connect them with the resources that they need and have them understand the importance of wearing the mask in the future. Dr. White may have additional comments on that.
No, I mean, I go back to Commissioner Brown. I mean, no shoes, no shirt, no service. I mean, what would you do if a child wanted to get on the bus without wearing a shirt, or if a child got on the bus without wearing shoes? You have a protocol for that. This is part of the accepted dress code, and I don't know what y'all do about that, but I would say it's an expectation that we have a new expectation because we have a new world that we live in now, the post-COVID world.
And the downside, and for those and superintendents, we're not trying to make light of the situation. The downside to that is an expectation, and it shouldn't be the same expectation as Dr. White said, is no shoes and no shirt. However, unfortunately, our society is currently divided. They're not divided on shoes and shirts. Pretty much everyone agrees you got to have those, and that's a societal expectation. Unfortunately, our society not yet is expecting mask wearing out in public, and I think we're slowly starting to turn that corner a little bit as we're seeing, unfortunately, cases rise in other states, and knowing that this is the only thing we have, and it is a cheap solution. While uncomfortable solution, it is a cheap solution to prevent spread to other people. That's the problem that districts will be wrestling with, is that they're trying to enforce an expectation that their communities have not yet embraced. And that's going to be very difficult.
All right, then next question I have is, can KDE and the group that worked on the thermometers look into the clear masks for hearing impaired students and their teachers? We are having a hard time buying these particular masks as they will only sell them in large bulk.
We actually had a conversation about that a few days ago with Greta and others at Kentucky School for the Deaf. I'm not sure where we are with purchasing those. we can certainly we're certainly looking into purchasing those for KSD and KSD outreach. But we can, if it's helpful, we can also look at how we can get that possibly on the state contract. Robin and Greta, can you all flag that?
Yes, we'll flag that.
Sure.
All right, the next question is will we be given guidance on how to safely conduct specific classes such as band, chorus, elementary music, etc.?
Yes, I've got a document from and I'm sorry, I don't remember. I know it starts with a K. They're one of the Ks, the band and music folks, and we're down to like 1 or 2 questions they have of questions that I had for them. I'm not sure where that document goes after that, but I know they're addressing the music aspect of it, is getting some guidelines.
Dr. White, that group is KMEA, the Kentucky Music Educators Association, and you've been kind to kind of comment on their first draft of a plan. And then once that gets finalized through the Department for Public Health, we will forward that through the cabinet for the governor's office review.
And John's on a post-it note on my
That's
list
right.
of things to do. So right there.
And to the extent that John's or the KMEA's guidance is more focused on the performance side and not necessarily the classroom side, I'm not sure if it's all encompassing or not. We can bridge that guidance together and working with them through the department as well, if need be.
All right.
This is the group that someone is doing some scientific testing and say, if I blow out of a trumpet, how far does respiratory droplets go versus if I blow an oboe versus if I blow in a flute. So someone is actually in their world is doing that scientific testing for them. So we'll have some real science to give you some recommendations with.
All right. The next question is, can kindergarten and preschool students ride the bus without a mask? Also, what about medical exemption students?
Well, if you're medically exempt, you're medically exempt. That does put you at risk, but if the student cannot wear a mask because they're going to get short of breath, we certainly don't want them to do that. Kindergarten and nursery school students, again, I go back to my 4-year-old granddaughter. If she was going to be in a confined area like that, we've already been talking about masks, and you can buy them in pink. And if it's pink, and especially if it has glitter on it, it rocks this world. So I would want my child, my personal family member, to be wearing a mask in a confined space like that. I think the decision has been made that it's not a guideline because would be so much difficulty to try to get compliance with that. But as a grandmother, I would want her wearing that for her protection.
Okay. All right. I think we are getting to the, can we clarify about, in previous webcasts, we were told we should not send home a student or discipline a student for not wearing a mask. Today, it seems we are hearing that we should discipline if they don't comply. Can we have some clarification as to what our expectations should be?
Well, the expectation is that you do everything within your authority to have students wear masks and rely on your building leaders and your teachers to think creatively on how they can get that compliance. Disciplining a student for not wearing a mask is probably a last resort, and that has other unintended consequences, particularly if the student doesn't have a mask or lost the mask. So I think our guidance has been to use other methods and leave that to your discretion. Anybody else want to comment on that from the KDE?
Okay.
There's one clarification, Tony, about I think when we were talking about wearing masks in arrival and dismissal situations. Dr. White, I don't want to put words in your mouth, but I think they're having trouble distinguishing between why are masks not required or why can students wear masks in lieu of social distancing everywhere else except arrival and dismissal? And I think one of the reasons why having a mask on or dropping your mask when you're 6 feet apart in a classroom is because you're seated and you're not moving around. My guess is the recommendation to have masks on at arrival and dismissal is more of an active students coming and going, perhaps getting up and walking around. Now, if it were a classroom type setting, my guess is, and every student was seated and they could take their mask off until, if they were socially distanced, they could take their mask on. If they were not, they would need to leave it on just like a classroom.
That would be correct. Anytime they're closer than 6 feet, they need to have that mask on. And I think if you have a whole school that's standing in line to get into the building, or a whole school that's in an auditorium, I think trying to police that 6 feet apart would be, it sounds to me like it would be a nightmare, but that's because that's why I'm not a teacher. So I think instead of following the rule book, think about what we're trying to do. We've got a virus that spreads when you're closer than 6 feet, and it can kill people. So if you're closer than 6 feet, you wear a mask to try to prevent that spread. If you can kind of think about why we're doing what we're doing, not the rules of how to do it, it will intuitively make sense to answer those questions.
All right. Another question on, will recess be allowed to be counted as instructional time? Will recess be allowed to be counted as instructional time?
That's not mine.
Robin or Todd, I don't know that we've dealt with that. I don't know why recess would be counted as instructional time.
Not at this time. I think that's the first time we've heard that question. We've had question on other types of activities that might be needed and asking if those could be counted for instructional time. For example, I think we had a prior question about the cleaning that might be additional cleaning that might be required either in classrooms or in cafeterias. And at this point in time, we have said, no, that would not be instructional time.
Okay, so that kind of concludes the questions that I can see for today, but I want to quickly jump. I know that you all have been using what we call at the department the yellow sheet, the Q&A document, and I'm happy to report that as of before today's webcast, that Q&A document is now up to date. So all of our questions and all of the questions that you all have asked and that we have answered either through the webcasts or through emails or that you have sent to KDE staff or to DPH staff. We have been, as I've mentioned in previous webcasts, we have been working through Google Docs to incorporate those questions into a Google Sheet. Many of you have been inquiring as to when that would be updated. My department had a shortage of staff. We were all now able to get that updated, and I'm very happy to let you know that is in fact the case. So in order to find that, I will send you out a link. We're going to be sending you out an email with all of the guidance document links. I will make sure that you all have that Q&A sheet, but it's really very simple. You just have to go to the, I believe it's on the COVID-19 page under the important documents, and it's called COVID-19 Answers to FAQs for Kentucky Schools and Districts. And it's under the orange Important Documents tab. So if you go there, there are hundreds of questions. You can type in, you can use your find key if you're looking for something on masks. So please, if you are looking for a specific question that you're not sure if we've answered, or if you can't remember the answer to, those questions should all be in that quote unquote yellow form. And with that, Commissioner, it's all yours.
Sure. Thank you, Dr. White. Thank you for joining us today. Whether you like it or not, you're now a part of the Kentucky education family. We're just a big dysfunctional family. We sometimes fight, but we all love each other, and we'll go to bat for each other at the end of the day. So thank you all for what you've done to help us along through this and help us to understand and get there. We're going to continue to have these webcasts weekly, and I know this is a good exercise for not only the superintendents, but all of us at the department as we work through this guidance. Superintendents and others, what I'm hearing from you, the issues that keep rising up, obviously the mask issue is implementation issues with that. You're still having concerns, completely understandable. We're going to try to help you at the state level with that by reaching out to communities, reaching out through other state agencies, the media, and the best we can to help make that more of an accepted practice to help you out with your students. Also hearing about the duty-free lunch issue coming up, emergency leave, whether or not that needs to somehow be extended through any emergency order or not. And then also, I've also heard, it really wasn't mentioned on this webcast, but I am hearing through some of the K groups that it's still being discussed about whether or not the 170-day issue needs to be addressed this semester, or should we wait until the General Assembly comes in, knowing that that's in January. And so we're still listening to you on that issue. We heard from you today that you would like to have a really quick survey so you can know from a statewide perspective the starting dates of schools and where those are falling by percentage of districts and the type of start. And we're going to ask that on the survey as well, whether you're going to start all NTI or you're going to start hybrid. And so we're going to get that out in hopefully the next 24 hours. So that's what we're hearing, and we understand the difficulty. And please hang in there. I hope everyone can at least have a day, take a day trip, do something, go see, just take a drive. That's what I'm going to do hopefully on Friday. So everybody have a good rest of the week. And if you have additional questions, feel free to email us, or you can always text me. Thank you.
Have a safe holiday weekend.